Hi, my name is Michelle Hurd, and I'm here to discuss the moral right to healthcare. Healthcare has been an ongoing issue here in the United States way before the Affordable Care Act was implemented in 2010. Former President Harry Truman, seeing that healthcare costs were too high, he wanted free healthcare, and he felt we were all entitled to proper treatment. However, not everyone was seeing eye to eye with former President Truman, and as of today, not so many with President Barack Obama. There are many citizens and politicians who feel that healthcare is a privilege, that we should pay for it if we want it. Today, there are different levels of healthcare. The more you pay, the better treatment you can receive. Healthcare to me is a moral right amongst everyone. There are many different laws in healthcare that give everyone the right to be able to have access to it, but there are three that I would like to discuss. We have the Code of Ethics, which is a standard code of conduct amongst providers to promise commitment, confidentiality, and relationships. Medical malpractice, which is a legal form of action to protect a patient if they were to be harmed by either misdiagnosis, failure to treat appropriately, or any injury caused by the care of a provider or healthcare worker. And you got cultural competency, being able to deliver healthcare services that meet the social, linguistic, and overall cultural needs of patients. Code of ethics are providers that have a standard code of ethics that promise those that they must uphold regardless of who they see, treat, and care for by commitment, confidentiality, and relationship. They have to have a commitment to have compassion and respect while providing competent medical care. They have to maintain patient to provider privacy and confidentiality within the law. They must uphold a supreme relationship regarding responsibility while caring for their patients and maintaining the patient's Bill of Rights, which is autonomy and fair treatment. Healthcare workers also must maintain a code amongst healthcare workers, which is health, safety, and well-being of their patients. They also follow along with the provider's code of ethics. Medical malpractice is defined as improper, unskilled, or negligent treatment of a patient. Medical malpractice is not something that anyone asks to suffer through. Unfortunately, it happens time and time again, leaving patients worse off than they started. Malpractice can have lasting effects that impact the lives of not only the patients, but the family as well. The federal government mandates over the patient's safety and quality of care, such as if a patient was misdiagnosed and possibly started medical treatment, this could be a violation of the tort law, possibly leading to medical malpractice lawsuits. For those who don't know what the tort law is unfairly causes someone else to suffer loss or harm, leading to legal liability. Each year, 12 million Americans are misdiagnosed. 251,000 deaths in a hospital year could have been prevented. 80% of this is all due to human error. It is the responsibility of the provider and healthcare workers to make sure that they have taken all necessary steps to make sure that these patients are all taken care of properly. Failure to acknowledge cultural competency can divide communication between the patient and those in healthcare. Having cultural competency in the healthcare system helps improve health outcomes, the quality of care, and can eventually eliminate racial and ethnic health boundaries. Cultural competency can be life-saving in a healthcare setting. Examples of strategies to move the healthcare system towards cultural competency and diversity would to provide education and training along with other cross-cultural issues. Education and training has the power to safeguard both healthcare professionals and patients from possible and avoidable adverse outcomes. Thank you, and I hope you enjoyed this.